Hey everyone, what's up? This is Dr. Charlie Johnson, physical therapist. Hope you're doing well wherever you are. Appreciate you checking out this channel. And I'm here today with a very special guest. I'm so grateful to have Jackie here. Jackie, I think, are you in Vancouver? You're in Canada, right?
I'm in northern BC,
Okay, cool.
850 miles north of Vancouver.
Okay, so a little bit further away, in the sense of not local to me. I'm in Pennsylvania at the time of shooting this. That's just where I born and raised. So quite a distance there. And Jackie, I just want to highlight for everybody here some things that you were dealing with, and just share your story because it's such an inspiration. As I know you dealt with back pain and a bunch of other things for like 20 plus years, pretty much your entire career. And I know you've really had some life-changing sort of ahas and been able to learn how to essentially self-resolve this. When I say self, with some coaching and resources and guidance and support through working with us inside the Glute Relief Accelerator program. So thanks for sharing the story here. That being said, if you can kick it off, right? Share a little bit about some of the things that you were told diagnostically were the cause of your pain. I know you had x-rays, MRIs, PT, chiropractic. You probably had a ton of different opinions. So let's chat about some of the diagnostics and or some of the things you were told were causing your 20 plus years of pain.
Okay. I am just like a million other people around the world, a slice of humanity,
Yep.
and been to all the doctors that North America has to offer. You know, you can go to your chiropractor, your physiotherapist, your acupuncture, been to MRI, and then you have Dr. Google as well, you know. So I've just been through the gamut trying to alleviate the pain that was a constant in my life for a long time.
Yep. And so you've probably been told you have herniated disc,
Yes,
degeneration, spinal
yes,
stenosis,
yes.
spondylolisthesis. Can we throw anything else in there?
No, but like you can tell that nerve is being pinched. You know, I've had 4 MRIs over the last, I would say, 10 years. And it just says the same thing that, but I have a running partner
Mhm.
for many years, and she used to say to me, I never wanted to hear her. She would say, there's a million people out there that have the same conditions as you, and they have no pain. And
Yeah,
I would
yeah.
say, yeah, but I have pain.
Yep.
So, yeah, I didn't want to hear that for many, many years.
Yep. Yeah, and that's a key takeaway too, right? So it's very common, especially in medical system, right? Here in this side of the world, and I would say probably everywhere, right? That you go somewhere because you hurt, and if you seek, you shall find. And they take a picture that's very zoomed in and of high resolution, right? And before you know, you have all these things, quote unquote, wrong with you. But now what we're finding is that a lot of these things are just part of like everyday life. So it would almost be like somebody getting worked up because their hair is turning gray. Now I know people get worked up because their hair is turning gray, but we generally don't catastrophize about it as if it's this abnormal thing, right? Instead, we kind of say, well, I mean, I don't have to hurt just because my
You
hair is
can
gray. I don't have
color
to
it.
have a
You can color it. It's not a big
you
deal.
can right, and you can have these problems, quote unquote, right? And you don't have to hurt per se, right? And so
Yes,
I think that's important for anybody watching. It's not a life sentence.
that's right. And it's like a 2-year process to see a surgeon in Canada. And I started that, well, probably a year and a half ago. And went through all my pre-op appointments even in March, I believe, but they
Mhm.
told me my surgery will be in January in 2025 and they're going to fuse my spine. And
Yeah.
I'm like, everything inside of me said, no, no, I don't want that. And then I just woke up the next morning and said, I'm going to do it. I'm
Yep.
just
Yep.
going to yield like all the other people do. I think I'm special or something that, you know, I can fight against this, but I don't know. It just wouldn't leave me alone. I did not want that. I've known too
Yep.
many people that get fused and nothing has changed in their life. They're in pain and they cater to their back.
Yep. Yep. Yeah. And oftentimes the reason we see that, right, is because it doesn't teach people, right, what they need to do. It doesn't give them the resources. It doesn't make them more resourceful, such at the end of the day, they know how to be self-sustainable. So yeah, you can go and get your car fixed, right? But if you keep doing the
Yeah.
same thing which made it break down, it's not going to work very well, right? And
Yes.
so it works for some people, but many people it does not work with. We work with many people who've had surgery and the problem remains. And so you just made a call too. Like, didn't they call recently and say, hey, like, are you ready for your surgery? What happened there?
July 17th. And I said, July 17th. I thought I had till January. And I told them what I was doing through your program. And I told them that I was completely, like I would say, like, I don't know, under 10 on some days, but completely pain-free on most of the days of my life. And that I didn't want to get off the list though, because I wasn't sure I could maintain this forever. So like, would they be my crutch until September? So they're going to call me back in September. And if I'm pain-free, they're taking me off the list.
Cool.
So, and I probably should have just said, go for it, go. But I just wasn't ready yet. And like, I would say I recently quit substitute teaching because I've been a school teacher, and I spent many years walking down that hall, limping and just in terrible agony and pain. And when I think about it, you can hear it, like it goes to an emotional place inside me. It made me raw and empty. I mean, it was everything, was the pain and the agony of that. And I started substitute teaching. I retired and began to be a substitute teacher. And I went to a classroom last year in the winter, and I had just read John Sorno's book, and it was a 7th grade class. And, you know, they can kind of eat substitute teachers alive. I had a little bit of anxiety, but the teacher was going to stay in the classroom for a little tiny bit. And while she was doing some things at her desk. And so I was waiting for her to leave. And so I thought, what can I do? I thought I can entertain them with a story. And so I started telling them about my pain and how bad it was, and just the whole thing. And then I said, and then I read a book. And I read John Sarno's book over a year ago. And I said, I'm completely pain-free. And the teacher dropped that pen. She stood up and she said, oh my God. She said, I need that book. And so the kids were all amazed. They were totally, she said to me afterwards, they were totally transfixed on my story. They couldn't believe that. And they were all telling me about their dad or their grandpa and the pain and all this stuff. And so anyway, then a short time went by, and I had a flare up, but I didn't have the belief or the confidence inside of me to make it back to the other side of that pain. I lost my grip on the ability, or the depth of my understanding hadn't quite developed roots yet. And I couldn't get pain-free again. And then last summer was the summer from hell. It just took me all the way down again. And then I started pushing towards the surgeon, and I got what I wanted. And then I don't know, I came across Charlie. I did a meditation, Charlie. I know you don't really go for that stuff, but it seeps out when you talk. But I did do a meditation, and I was trying to receive guidance, right? And out of the clear blue, you came up on my YouTube, and I called you. I thought, I'll email him and get his free book. And then I thought, I'm just going to call him. I didn't know where you were, but you were a 3-hour time zone difference than me. And it was 8:30 at night, and you answered the phone. Oh, that was everything for me. And I knew that I was just going to sign up the next day, and I did. And I haven't looked back. The chronic neuron pathway pain was my issue. I don't care what the MRIs say. I don't care what the physiotherapist, the laser light shining on me, the acupuncturist. I mean, you can go down the list. I'm not even taking inflammatory pills. I'm not doing anything but living my life fully, doing everything I want all the time. And it's really unbelievable.
Awesome. Yeah. And so you basically We could probably cancel it, but we held on to a little bit, right? But we get a call, set up for spinal fusion, no
Yeah,
longer getting spinal fusion. You're not going to need that, by the way. You got what you need, and you know you do,
yeah,
right?
yes,
And so now we'll just, once we get to that full point where we're like, okay, we can call and we can cancel that. But off the list now. And yeah, had gotten to a point where you'd had this in the past, right? Were able to become mostly pain-free, right? But then had a flare-up again and felt lost and confused about what to do. And obviously that's when you reached out to me. So I'm glad somehow algorithmically, right, I came across your feed.
yes.
I don't know how to change that, but it must have been that. And so let's talk about this, right? Because again, there's going to be people watching this who say, oh, that's really woo woo. That's really weird stuff. I mean, is the program we've created and everything that we provide within it, is it woo woo? Is there science involved
No,
here? Like, talk to me about this.
no. Science is really important, and that when they can begin to give you proof that there have been changes that take place in the brain when somebody's in pain, and when somebody is in chronic pain, and when somebody is relieved from chronic pain, that's everything. When you
Yep.
can see that it's in the brain.
Yep. Awesome. And so, yeah, we start the process. Even though I'm a PT, I have my board specialty in orthopedics, right? So that's what I do, right? Disc problems, piriformis syndrome, sciatica, all that stuff. We deal with that stuff as well, right? But the body is the instrument of the mind. And so one thing I tell people all the time is like, yeah, we can talk about that stuff, but this drives everything, right?
Yes.
And so the first place we start is not by doing more, but instead helping people go from a place of not knowing to knowing. And how do you do that? You're given the right knowledge and information so that you can have not fear and like worry and concern about, will I get better? Oh my gosh, what am I dealing with? All this. Chances are you will get better, but you just don't know it because you don't have faith in understanding what pain is, right? What you're really dealing with, and a proven process to follow so that you can get out of it. And I think that's what we bring to a lot of people is like, hey, there's thousands of other people like you. And so within the process, obviously you have those people to lean on, but we also
Yeah.
give you what you need to start to shift your, I call it like pain paradigm, the way that you view what you're experiencing. And so
Yeah.
it is very science based. And we begin by educating people on the fact that, yes, pain, even though it can be caused by an issue in the tissue, a body problem, and you may be watching this believing that it's due to some pinched nerve or stenosis or
Yes.
degeneration. Everybody has those problems pretty much from 20 beyond, right?
Yeah.
And it may be the source, but we need to first help you understand that it may not be the source, and or what is a different way that we can start to view the pain that you're experiencing. And yes, pain, especially as it becomes chronic, becomes like a grooved neural network, right? Just like
Yeah.
water goes down a
Yeah.
mountain like over and over and over again, the longer you're in pain, whether it started with an injury or not, the more you start to become fearful of movement. Movement equals pain, activity equals pain. Pretty soon life equals pain, and you're not doing anything because you're so afraid to move and do stuff, right?
Yeah.
The more avoidant you become, that sends more danger, right, to the brain, more fight
Yes.
or flight. The less you move, the more fearful, etc. And so you can actually see these signatures on functional MRIs, right, where you have some noisy neighbors. One area, which is designed to generate pain, becomes multiple areas, and the brain starts talking to one another. And
Yeah.
before you know it, you start to get stuck in this chronic pain loop, right? And this stuff is valuable for anybody who's experiencing symptoms, whether it just happened yesterday or it's been going on for 20 years. And so
Yeah.
if pain is a danger signal, we like to help people see it as that, right? And if we
Yeah.
can reduce the fight or flight reaction to it and help people understand what it really is and what they're dealing with at the core, then not only can you see brain changes, all right? And
Yeah.
again, this is supported by the science, but you can actually see changes, more importantly, like in your life, right?
Yeah. Yeah.
Absolutely. Really cool. Really cool. So not woo woo stuff. Now let's talk about this, right? So as far as the way that you started getting back to living life, right? So you were struggling to the point of not doing a whole, I mean, I know, gosh, you couldn't really sit when we first started. What are some other
Yeah.
things you had trouble with in the beginning?
Um, Bending over,
Mhm.
sitting was like everything, you pretty much, you get up in the morning and you don't sit down, and you try to wait and wait and wait longer in the evening before you finally go and sit in a chair. Yeah, that was pretty awful.
Yep.
Now I can sit down anytime.
That's good. That is the goal, right? Um, and so let's talk about this from a process standpoint. we didn't just come in, right? And I didn't have you come in and say, hey, you're going to do all these stretches. That's probably what people think that they need to
Yeah.
solve the problem. And maybe it can help some people, but usually what does that do? Well, if you're doing stretches from a place of like, I'm doing these things to fight off the pain, then it makes you more freaked out, worried, and focused on it. And
Yeah.
so where did you start the process? Education, obviously, right? But
Yes.
like that subtraction phase of things. Let's
Yeah.
talk a little bit about what that looked like for you. Can you share a little bit?
Wasn't trying to do any exercise at all, or I wasn't bringing the groceries in the house, lots of things that are just everyday life chores. And I started changing some of the way I do things, like the way I bend over now. Like, that one of the chiropractors told me don't bend over. And so then I left at that point, and I counted how many times I bent over by noon, and it was over 50 times. I thought, like, I can't live my life and not bend over.
Yeah.
But I changed how I bend over. I changed how I was doing some things so that if there was things that I was doing, that a flare up wouldn't take place or it wouldn't irritate things.
Yep.
And
Yep.
so I even changed how I sat in a chair. I made my 90-degree angle larger then, and tried to just what you say is like to don't poke the bear. Try
Yep.
to
Yep.
calm the muddy waters is so you can go from there and figure things out.
Good. So now, no, it's perfect. So did you, I call them tweaks, right?
Yeah.
Did you do them blindly where you're just like, hey, I came in and I was just like, oh, step one, we optimize the healing environment. Mentally, we start to educate you about what you're really dealing with, right? And why you hurt. Physically, right? Regardless if this is a structural or non-structural mind or body problem, right? We start to help you find more safety in the way you're
Yes.
bending, you're sitting, etc.
Yeah.
Did you have a process for doing that, or is it just like randomly you just discovered that?
No, as I went through the program, there are activities or assignments per se that allow you to go through checklists so that you can see um, what movements bother you and what movements make you feel better
Yep.
and what movements don't impact you at all. And so movements for sleeping or positions for sleeping, for walking, for bending over, for driving in a car, all the things that you do in your everyday life. You had some worksheets that I don't like that word, worksheets. You had some um, um, assessments to do
Yep.
that
Yep.
would allow you to identify what is helping you and what is hurting you.
Yep. Good. So yeah, so we start by doing detective work physically and mentally to identify not only the source of what's driving symptoms, in this case, 20 some years of it, right? But
Yeah.
also to identify what things physically might be picking the scab or keeping you from getting better or sensitizing the nervous system. And so, yeah,
Yeah.
we go through, I call them tweaks for whatever worksheet, you're right. But maybe that sounds like a lot of work. I mean, really, it's just giving you the tools to kind of choose your own adventure, right? So you can find, oh, for you, changing the way you're positioned in your chair might help this way for you, but for somebody else, it might make them worse. And so we
Yes.
go through and we start to kind of scientifically and systematically check things off so that the quote I like to use is like, hey, you cannot exercise a bad diet. If we would have just
Yeah.
thrown you into exercise, just like
Yeah.
you said, right?
No.
You can get all the adjustments you want, but if you're bending in a way, you can't not bend, by the way. So the goal is not
Yeah.
to make you move. It's to say, hey, you can move, but have you ever thought about doing it like this? And then
Yeah.
what does that tell you about how you can solve the problem? So we optimize the healing environment. Fair?
Yeah. The way I bend over changes everything.
Yeah. Yeah.
It's awesome. Like it's a no-brainer.
Yeah. Really cool. So we discovered some ways that feel safe to move, right? And
Yeah.
then, right, how did we know? So then we gave you something, right, within 24 hours. I call it a private healing log. And so,
Yeah.
like, within that, like, how did we know if you were moving in the right direction or not? Did I ask you, like, hey, how are things going? Right?
Yeah.
Or was there more behind it than that?
Using the GRA spreadsheet that you give us, it's an opportunity for us to assess ourselves and keep track of where we are and where we want to be.
Yeah, totally. Yeah. And so it's like, hey, if you don't chart, just like a pilot, right?
Yeah.
If you're flying through the dark, right?
Yeah.
And you are using your instruments to get somewhere. When I say flying through the dark, that's what most people probably watching this video are doing right now, right? Fly
Yes.
by night. Let's try this. Let's see what happens. I'm going to go here. My friend
Yes.
said this, my whatever. And so if we kind of have blinders on, you're not really sure which way to go. You have to, I say you can't manage what you don't measure. All right. So
Yeah.
the second part of the process is not only are we optimizing things mentally and physically, but you've got to have a scale. Now, it's easy when you're trying to lose weight. Everybody knows what a scale is. You go buy one. You can check week to week if you're moving in the right direction or not. And if
Yes.
you're not, you have to change what you're eating or what you're doing,
Yes.
right? If you're the
Yes.
same, you got to change something. If you're better, then we don't need to change, right? And
Yes.
so blood pressure, we've got cuffs. Sugar, we've got little things that prick your finger, right? But when it comes to the pain experience, it's just really hard for people to kind of explain what's happening and what they're feeling and objectify it. We know
Yeah.
MRIs don't objectify it because everybody
Yeah.
has the problem. And so if everybody has the problem, how helpful is it to see that you have the same problem that everybody else has?
Yeah.
Not that helpful. So
Yeah.
we measure things.
Yes.
Yeah.
And so like I think that when I started, I was up at 80 and 90.
Yep.
And you can see it's not there. I've got zeros and I've got a couple tens, but mostly I'm in the green zone all the way.
Yep. Yep. Awesome. Yeah. And so then what we do is we identify for people, well, what points do I measure? What instruments within the cockpit do I look at to see if I'm on track to land on the runway? Right.
Yeah.
Well, if you want to get better and you got X, Y, and Z as your goal, we need to reverse engineer and say, okay, now what we need to look at is we need to look at two things, right? And so I have people track 6 numbers, but basically we need to find some motions that are problematic. And sometimes people have no motions that are problematic. Okay.
Yeah.
Sometimes people have every motion that's problematic, but let's simplify it and find just a few we can look at, right? And why are motions important? Because yucky motions or motions that are problematic show up in life as certain activities that you have trouble doing, all right?
Yes.
Generally for people. And so we can track knowing that if we can get the motion to feel better, to feel more safe mentally or physically, then we generally see people be able to sit better, walk better, do activities better. And then we can look week to week to see and look at the trend, zoom out and say, hey, are we on the right track, Jackie? Are we going to where you want to go? And then the cool thing is you're reporting this.
Yes. We're in charge of ourselves.
Yeah, totally.
We have all the support that we need. And that's hugely valuable.
Mm-hmm.
Yeah.
Yeah, let's talk about that for a minute real quick. So we talked about part of the process, right? Let's talk about the support inside of the platform of the program, right? Did you feel like you were, even though I don't know how many miles away, you're really far away. Did you feel like you were alone in the process? Did you feel like you didn't have the support that you need? What was that experience like, just candidly, if you can share?
Yeah. Well, I don't really like social online groups.
You've changed, you're here.
I know. So I like to like go in and be shy and not interact, but it's very important to be able to go online and find other people that are speaking the same language as you and that have had the same experiences as you. And they are there to encourage you and inform you and share resources and really you don't feel like you're alone anymore. Like some people with chronic pain, they want to walk up and everybody knows they're in chronic pain, and other people, they want to hide it from everyone. They don't want anyone to see where they are. And but finding a group of like-minded people is very important because we all need support.
Yeah.
We're all walking each other home.
Yeah, totally. And one of the things that sometimes people say is like, because inside the platform we have access to a classroom so you can learn what you need to do. It's very educational. That's pretty much what
Yes.
I'm trying to do is I move from a place of fixing people to teaching people. I'm a teacher at heart, right?
Yeah.
Knowing that long term, if I could teach someone how to fish, they would have a way better chance of solving the problem. So you get access to a classroom, all the knowledge, resources, everything, boom,
Yes.
right? Then you get access to a community and then obviously mentorship and coaching. But a lot of people are like, I don't like communities, or how am I going to benefit from a community when I have this problem? And have you ever seen any problem like mine? Right.
Yeah.
So
What
are your thoughts on that?
Just a slice of humanity. We're all the same. We're all the same. Yes.
Yeah. Yeah. And so what I say to people is like, hey, you have a brain and you have a body. And so even though your pain might be here versus there, and or someone's been said they have this, or someone has said, that they have that, a different diagnosis, the symptom experience and the sensations that people experience and the pain experience is so similar across the board. And so
Mhm.
if I teach you, Jackie, the concepts and the principles and give you the path, you're going to choose your own adventure a little bit. Somebody else
Yeah.
with 20 years of pain might not like bending the way that you like bending. They
Yeah.
might not respond as quickly or whatever right as you do. But I know that if you have the principles and the concepts, then you can solve the problem. We talked
Yes.
about optimizing the healing environment. We tweaked the way that you understood what pain was. We gave you the support, the resources, and knowledge there. We changed how physically you were maybe aggravating the problem in ways that maybe you weren't aware of, right? Did the chiropractor like teach you different ways to bend, or did you say don't bend?
He said, don't bend.
Yeah, that's really difficult in life. That's like me saying don't live life, right?
Well, I've got this cute little cockapoo.
Uh,
I got to pick her up.
right, right. So if you're watching this and you're doing lots of different exercises, but somebody's not educating you about how to improve your sleep, how to tweak and or modify and do the detective work to figure out how to bend, lift, sit, and twist, you can go there all you want, but you're going to go back to an environment which is not conducive to you getting better. So we really focus on that. We shifted from that place of doing lots of yucky to finding more yummy and
Yeah.
unloading the yucky side of the scale. Now we started to give you a tracking system so you know exactly what you need to look at week to week, and you can make decisions, Jackie, not off of how you think or you feel or if it's sunny or it's cloudy, right?
Yes.
But instead based off the data. And then we can fold in motion. All right. Now, when did we give you a sheet of exercises in the sense of like, hey, do these 10 things, do these 5 things, and then come back next week? Can you
No.
describe a little bit of what that process was like for you?
You have a system that's called hunting for emotions. I think that you're looking for ways to move your body that does not hurt so that you can create neuron pathways that show your body that you're not in danger, that you're making these movements, you're developing positive neuron pathways that are telling your brain you're not in danger and movement is okay. And so that you hunt for emotion that doesn't hurt. And then you just begin to add that motion to your life every day for the purpose of creating those neuron pathways of health and vitality.
Yep. No, this is good. So, okay. So to make sure this is clear, right? So most people, right, see pain as only a body construct, right? Okay, I've
Mhm.
got this problem in my disc, in my back, in my piriformis, in my butt, in my leg, in my hip, whatever, right? If we understand that it's more than that, right?
Yeah.
Brain is really, again, the thing which drives a lot of our experience here in the body. But there's multiple elements to this negative feedback loop, which we call the pain experience. So when
Yes.
people get injured or when people start to experience symptoms for whatever reason, do they more or less? They move less, right? And they live less life. And if life is motion, they start to move less. And so the
Mm.
less people move, the more fearful they become. The more fearful they become, the less they move. And before you know it, people live a smaller life. We talked about this a little bit before. And so how can we start to change the pain experience? Well, number one, we can start to educate people on what symptoms are and what they're experiencing so that they're less fearful. And if they're less fearful, oh, I can do that. I'm not actually damaging myself. Wow,
Yeah.
this should get better in 3 to 6 months, but I've had this for 20 years. That's weird. Oh, there's lots of other people who have the same image findings, but they
Yeah.
don't have to hurt. Okay, I can now feel more confident about doing things. If somebody else can do it,
Yeah.
I can too. Great.
Yeah.
So now we started with the mind, but then, right, we can also use the body as like a crack in the basement foundation, as a crack in the wall, right? And we can
Yes.
find our way, right, by starting to test motions or go hunting for specific exercise. I call it hunting for motions. So we can find motions that feel safe,
Mm-hmm.
and then we can try on those motions such that when we do them, we start to say, wow, not only did that make me feel good, right? It made my yuckiness within my body less yucky. I can bend over better now. So I know it works, buy-in and belief. And number two, right? Wow, movement doesn't have to hurt. That's kind of cool. Now I have another tool, right? And so now
Yeah.
we pair these together, brain and body. We can bottle up that movement that we find, the one thing, right? And we can start to then,
Yeah.
yeah, one movement, and we can start to apply a certain prescription to it. How much do we do it? Dose. How often do we do it? When do we do it? Maybe it makes more sense for you to do it in the morning versus afternoon versus night. And so we can really refine this. Maybe you just need to do it on one side of the body versus both sides of the body. And so we can get
Mm-hmm.
very specific about the motions that we're doing, right? And how many like motions did you do?
I just did the first one.
The first one. Okay. So you did one motion and it was the
Yeah.
first one that you came across,
Yes.
right?
Yeah, well, it was the first one on my list,
Yeah, yeah,
and, it was the clamshell,
yeah.
and, so, yeah, just doing that is is nothing.
Yeah, you don't have to be
Even
ashamed
that,
about that.
yeah. Well, I meant, like, it's not like you asked me to go and do a pull-up or anything, like, it's easy.
Yeah, yeah. So one motion, right? Um, that's it. All right. Pretty
Yeah,
simple. Then you can, because you tested it, you know that it works and you know it's helpful. Then we can
yeah,
start to zoom out, look at how we're trending. Oh, better. We don't need to change the motion. We just do one
yes,
motion. And so this
yes,
is why I say a lot of people watching this are just going to be one motion away. I don't care if you had it for 20 years or
yeah,
for 20 minutes, right?
yes,
Usually you can find the one thing that's going to work if you test, don't guess. So we use
yes,
motion as a positive entry point into a sensitive nervous system, not necessarily to fix anything that's broken. Most people are less broken than they've been led to believe. But instead, if we can start to move in ways that feel good, wow, that doesn't hurt. PT doesn't have to make me worse. Chiropractic treatment doesn't have to make me hurt worse. And not only that, it allows me to move better immediately. And it's super simple. And if it's fun or easy, it'll get done.
yes. And it is building neuron pathways to your brain and back again, that are telling you that you are safe, you're not in danger.
Yeah. Yeah. Oh, movement isn't too bad. This exercise helps me. Okay.
Yes.
Let me move more. I'm less worried. I'm more confident. Boom.
Yes.
Before you know it, brain, body, brain, body. And we flip that negative feedback loop to a positive one and you keep compounding it. You keep
Yes.
multiplying. And then
Yes.
this is the result. Right. Really cool. And so one last little thing here, maybe I'm getting excited about this. You mentioned something, a little nugget. You said, Charlie, it was the first one on my list.
Yes.
All right. Can you talk about like how you arrived at that list that you're talking about? Do you remember what that is?
It's uh, there were like 4 different lists you could have,
Pain
and I guess,
patterns. Pain
yeah,
patterns.
pain patterns,
Yep, yep.
and you go through an assessment.
Hmm.
It identifies what pain pattern that you are, and
Hmm.
then you go to your, whether it's pain pattern 1 or 2 or 3 or 4, you go to your pain pattern assignment and
Yep,
you start exploring in there
yep,
for the first exercise that is good for your body.
yep.
And then when you find the one that is good for you, that is where you begin.
Yep. Awesome. So again, choose your own adventure. Right now, a
Yeah.
lot of people say, well, hey, so then this is just a cookie cutter. Like there's these 4 pain patterns and you've worked with thousands of people. And so, do I just get the same exercise as everyone else? Well, there's only so many options and ways to move your body. And I explain this, right? So a lot of
Yeah.
people think there's something special about motion, but it's like, hey, you can only move forward, backwards, right, left, and you can twist. You've only got northeast, south, and west, and then you've got in betweens. And then you've got different body positions. So here's the menu of possibilities. Now, based off your story, where you hurt, how long you've been dealing with things, what makes you feel better, worse, there's a pattern there that we've seen. I've found 4 of them. And we fit into one of those. And then that gets us in the ballpark of this is where I begin testing. And so
Yes.
now you find what's going to work best for you. And someone else in the same pattern might find a different motion that works for them.
Yes, and they might not be lucky like me and get the very first exercise, but they'll find themselves in there for
Yeah, yeah.
sure.
Totally cool. And so to wrap this up, right, at the end of the day, the goal is to give people all the tools, knowledge, resources, support. We never take away access to the support, if you will. Classroom, you can still shoot me messages or you leverage the community and things like that. Do you feel like, I know we haven't canceled the fusion yet, but we pushed it off. Do you
Yes.
feel like you have the tools that you need and the resources that you need in the future such that you are self-sustainable?
I absolutely feel like I have everything that I need to continue forward.
Hmm.
And I'm very happy that I found you. And I feel very supported. And I've only been active in this community for 12 weeks, but I don't know, maybe 6 of those weeks I've been pretty much pain-free.
Hmm.
I was ready for this program, and this program gave me everything I needed.
Awesome. Awesome. So
Yeah,
20 years of pain, 6 weeks, right? On the right track, pretty much doing everything
yeah,
you need, feel fully supported in the future. That's my goal is if you're watching this, you could go to someone else, right? Say, hey, you've got 4 options: pill, shot, surgery, or kind of mind in motion, a natural approach. You can go to someone and have them move you or fix you or manipulate you. Or what if I could just teach you what I know, right? And you could learn to do it yourself. I think that's more self-sustainable. That's what, Jackie, you found
Yes.
through the process and program.
Yes.
Cool.
That's exactly what I found. Yes.
Yeah, yeah.
Yeah.
Awesome. What would you say to someone as a final line here who's on the fence? Hey, I'm a million miles away. This guy's on the internet, right? And he's saying he can help me and has a different approach. And I'm sort of on the fence. I'm not sure this is going to work for me. Can you
Yeah.
share something, words of wisdom?
Yeah. You're going to probably find yourself here at some point in your life, because I don't think that you're going to find what you need with surgery or injections or physiotherapy or acupuncture, because I've been down that road, and I'm not any different than anybody else, and that we all have brains that are amazing, and we have bodies that are amazing, and they heal on their own, and it can be handled. I'd say you have nothing to lose but your pain. You have nothing to lose but misery and sitting on the couch and sorrow. You have nothing to lose. Why aren't you trying it?
Cool. So hopefully this was inspiring for people. Jackie, so many years of pain, so many ups and downs. I remember when we chatted before, you got emotional, right? I can even tell as you share some of this stuff, it's just like, wow, a reflection of how far you've come. So I'm just so proud of you. And again, I appreciate you sharing your stuff here, right? As far as your story and your insights too, because I know people can grab many nuggets from this. So look, if you're watching this and you're like Jackie, where maybe it hasn't been 20 years, but maybe it's been 10 years or 2 months or 2 years or 2 days, and you're like, hey, I want to find someone who understands not only the body side of things, but also the brain side of things and can help me kind of connect the dots between the two, because it's like a big puzzle. And a lot of people, right, see things in their own way. And we're trying to step back and say, look, there's lots of different approaches. Luckily, we've kind of gone down all of them and we synthesize everything, put it under one roof to give people the best chance of solving this. And by the way, Jackie doesn't have to rely on someone else to put her back into alignment, right? She knows what she needs to do to get back on track. And so this is not only a short-term thing, but then long-term, we want to give you everything you need to succeed. So if you're watching this and you are looking for a different approach, go ahead, click the link below this video, apply to work with us. I'm not sure if we can help you out yet, but as part of that process, to submit a detailed case review after you schedule to chat with us. Jackie submitted a case review, I think multiple pages of a case review, right? And so you can be as detailed as you want in that, share all the details of your specific case. I will review it personally. If I don't feel confident I can help, then I'll just reach out to you. I called and or picked up Jackie's call, I think at 8 o'clock at night. I think my daughter was screaming in the background. So I can't promise you I'll do that, but I will do everything I can to touch base with you and give you some alternative recommendations to make sure that you're taken care of either way. Either we can help or we can't. And then on the call, we can chat about what that looks like. Okay. So Jackie, thank you so much for sharing your story. I appreciate it. And yeah, we'll be in touch. Let me know if you need anything. You always have access to me and the rest of the healing community in the future. Okay.
Yeah, and I appreciate that, and I appreciate the live weekly chats that 3 times a week I have access to you for an hour and a half. I appreciate that, and sometimes well, most of the time I just listen to them.
Yep.
But you are available, and that's everything, because I know if I put a red flag up, you're going to be there. I know that.
No problem. Let me know if you need anything and we'll go from there. Again, if you're watching this and you're interested in a different approach and really want to learn how to help yourself, click the apply link below to see if we can help. All right. Thanks so much. We will chat soon. Bye.
Bye.